I'm doing very well. I have much of my strength returned, and I can't wait for the summer months in which we can begin getting our exercise regime back to where it was. My appetite has been great. Haven't had any symptoms or problems since I've been cleared, and of course, I thank God for that. There's been a lot of praying, tell you by yourself, and of course, between the help from the health professionals and help from your family and friends.
Were you surprised that you tested positive a second time?
No, I was just really disappointed. I almost decided to change my name from Buckley to Lucky after the second time because I was just devastated when I first got hit. And then, of course, the second time I said, geez, what kind of luck is this? And after a while, my perspective changed because so many people didn't survive COVID. I know a lot of people that in my community, there's a number of people that died from COVID. And then you think about the people that suffer with heart disease or cancer, they deal with this every day. So you get a different perspective, and I was lucky I survived. Others didn't. And to this day, there are people still struggling with cancers and heart disease and so on. So your perspective changes.
So you've been vaccinated, you've had COVID twice. Are you scared of getting this a third time?
Well, obviously I am. If I'm going to run on my luck with COVID, then I might just run out of time here. So I'm very careful to get COVID, not to get COVID. I'm going to be very anxious to get my second booster shot, and even that we'll wait a couple of weeks before we start hearing from the health professionals what's going on. And we listen to our health professionals. That's where I get all my advice from. And because I look at the history of how the North was treated during the pandemic, we had no leadership in the province. And I'm not doing this to be political, but we were on our own. And the health professionals were the ones that rose to the occasion, and the leaders as well.
I want to talk to you about the North because the North got an awful lot of attention early in the pandemic as COVID-19 rapidly spread through that community. How are your constituents doing now?
They're like everywhere else. They were getting COVID fatigue. They, especially the young ones. The older ones, the more seasoned leaders, are always aware and are, they always think this threat will reemerge, and I credit them for that. I think a lot of our community support programs, they also learned a lot of valuable lessons. So they're kind of putting together a playbook. But they are hopeful that the pandemic will ease. They are striving for normalcy, like anywhere else. But boy, it was a lonely path for Northerners this last number of months. But with good leadership, with a little bit of faith and some good planning and some good intervention by the federal government, notwithstanding what these guys didn't do for us, we were able to survive the COVID pandemic.
You mentioned barriers. What do you think the biggest barrier is for the North returning to quote unquote normal?
Well, as I've said before, if you look at the lack of services in the North, we need a lot of home care and just public health measures and awareness campaigns. Those will be very helpful. We've got a lot of that recently. The barriers as well include the fact that in many of these northern communities, you have overcrowding in these homes. And so it's, you got 8 to 10 people living in a 1,200 square foot house. If COVID ever gets in there, you're affecting everyone, and then you times that by 40, 50 communities, you can see how that would become a barrier. And then you look at the fact that we're isolated. We got long ways to the major hospitals of Saskatoon and Prince Albert. And so there's a number of barriers that we have to address. And that's going to take some good, timely investment by not just the federal government, which you hope will come to the table again, but by the province as well. They don't get a free pass on this. They got to do their part because these are Saskatchewan people we're talking about.